So again, welcome everyone to today's webinar, Connecting Public Health and Aging, New Opportunities for Collaborative Planning. Today's webinar is made possible with funding from RRF Foundation. My name is Elise Ramos, and I'm here from the Illinois Public Health Institute today. And I'm joined by some of our other IPHI colleagues. Um, let's introduce now. Sarah?
Sorry, struggling with my mute button. Hi, all. Sarah Flores, Program Director of Community Initiatives and Systems here at IPHI, and I'll be speaking more later. Jana?
Hey, good afternoon, everyone. Thank you for joining us. I'm the Chief Program and Policy Officer here at the Illinois Public Health Institute and excited to have you here today. And Leah?
Good afternoon, everyone. My name's Leah Barth, and I'm a Senior Program Manager for the Alliance for Health Equity at Illinois Public Health Institute.
And thank you all. So today we're going to start off with some housekeeping that I'll go over. Then we're going to jump into the project background. Then Leah is going to give an overview of the Alliance for Health Equity Collaborative. And then we're also going to have a wonderful presentation from Age Guide. At the end of our webinar, we'll be sharing a new mini grant opportunity. So wait to hear about that. I should have been showing this the whole time. All right, so throughout the meeting, please feel free to use the chat box for any questions or any technical issues. Again, we are recording this, so you'll be able to access it after the meeting as well as the presentation materials. If you do want to use closed caption, you can in Zoom. If you hover over your Zoom toolbar, there should be an option that says show subtitle or view full transcript. And if you don't see that, you can click on the three dots. And again, if you're having any trouble with that, please send me a chat. All right. And I will pass it all on to Jana.
All right, so just briefly, this webinar today is being hosted by the Illinois Public Health Institute, and we work to collaborate to advance health justice in the state through equitable policy systems and institutional change. And so if you go to the next slide, the purpose of the webinar today is really to provide background information on the health impacts of social isolation and some of the past work we've done to build capacity between public health and aging as sectors to collaborate. We also want to highlight some public health and aging collaborative planning opportunities that are underway here in Illinois, and then announce a mini grant opportunity to support local health departments to build partnerships with aging to advance social connectedness. And again, this is made possible with funding from the RRF Foundation for Aging. Next slide. So in the chat, we'd love for everyone to introduce yourselves. If you want to put your name and organization in the chat, and one thing that makes you passionate about social connectedness. So go ahead and start to do that so we can see who's in the room today. And I see some folks have already started to do that. So welcome to those. We have Little County Health Department, welcome. We have Meals on Wheels. We have Egyptian Area Agency on Aging. We have, let's see, some folks from out of state, welcome. We have some public health consultants, social service agencies, aging, AAA folks, adult protective services, more health departments. Awesome, welcome everyone. Thank you RRF Foundation for Aging for being on. Great, UVI Extension, Boone County Health, Boone County Council on Aging, Catholic Charities, Rush, welcome everyone. Awesome. So we do have a quick poll. We are going to launch this just to see what sectors are represented today. So if you could please complete this poll. What best describes you? We know you might be multiple things, but public health, aging, social service. And if it's other, go ahead and drop that in the chat. We'll give you a moment to fill this out. Get your final response in. All right, slow down. I think we can go ahead and end the poll and share it. All right, so just over half of you are from the aging sector, 38% from public health, and 8% from social service. A couple others, I don't see them in the chat, but welcome to everyone who's joined. You can stop sharing. Okay. So with that, I'm going to hand it over to Sarah to provide some background, and then we'll hand it over to the rest of the speakers as well. So go ahead, Sarah.
Thank you. So in 2023, the U.S. Surgeon General issued an advisory on the scope of the issue of social isolation and the associated health harms, including a greater risk of cardiovascular disease, dementia, stroke, depression, anxiety, and even premature death. In fact, the report cited research that compares the mortality impact of being socially isolated to the harms caused by smoking up to 15 cigarettes a day. So that's even greater than harms associated with obesity and physical inactivity. Social isolation has emerged as a major public health concern here in our state in Illinois. We have a rapidly growing older adult population. So population age 16 above is projected to be 25% of our population by 2030. And there are significant proportions of residents that report poor mental health and a lack of emotional supports. And as we can imagine, the pandemic greatly exacerbated issues of social isolation and loneliness, especially among those vulnerable populations that include older adults, caregivers, rural residents, LGBTQIA residents, and people living with disabilities. And studies also show that social isolation and loneliness increases the risk of premature death from all causes. It's linked to depression and cognitive decline. Conversely, though, studies that show strong social connections and networks can boost a person's lifespan by up to 50%. People living in socially connected communities are physically and emotionally healthier and more resilient. Next slide, please. So some of our early work on this. So prior to this advisory, social connection was a newer area for public health, and IPHI had been increasing its focus on this through the pandemic. So through a previous grant from the National Association of Chronic Disease Directors, so it's called BRIC, Building Resilient and Inclusive Communities, we learned more about the health impacts of social isolation and loneliness, and about frameworks and strategies to advance and improve social connection in communities. So with this new knowledge and capacity, along with IPHI's rich network of multi-sector partnerships, many of you who are on the webinar today, including our Illinois Alliance to Promote Opportunities for Health. That's a statewide policy and systems-focused chronic disease prevention coalition. So with our partners, we set out to build the capacity of the public health sector and aging partners throughout our state to collaborate to advance social connection. Next slide, please. So we engaged Healthy Places by Design to present at our 2021 coalition meeting on socially connected communities. You can see the report cover there. It's a report that aimed to reframe the social isolation conversation to focus on root causes, which are also key determinants, social determinants of health. So healthcare, housing, transportation, use of public space, etc. So this report and the accompanying recommendations in it sought to spark ideas on ways different sectors can work together to redesign community-level systems to support meaningful social connections. Next slide, please. Another key framework from the Foundation for Social Connection is the Systems of Cross-Center Integration and Action Across the Lifespan, the social framework. I'll chat the link in a moment. And it explores how sectors can work together at the individual, interpersonal, community, and societal levels to promote social connectedness. Next slide. So one more report is that nationally, in August 2020, the Office of Disease Prevention and Health Promotion released Healthy People 2030. It's a decennial report, provides a 10-year measurable public health objectives and tools to track progress toward achieving them. And now it has a no focus on well-being. There are objectives related to social cohesion, referring to the strength of relationships and the sense of solidarity among community members. Next slide. So with these frameworks, with this knowledge building, with the partnership buildings, That led IPHI to apply for funding from the RRF Foundation for Aging. That funding is making today's webinar possible. There were two goals in the first round we had. It was increasing knowledge around social connectedness and the impacts on health and strategies for integrating social connectedness in these cross-sector efforts, and also a second goal to develop and grow partnerships between public health and aging in 4 regions of our state. So as part of the work, we did a statewide learning series introducing the frameworks you just saw, building this knowledge base and awareness among specters, sparking ideas for collaboration. And we also solicited input from our partners to develop a set of recommendations for advancing collaboration between public health and aging partners to advance social connectedness. A bit more on the communities we work with, and some of them are on this call today. So Age Smart in the St. Clair area, they worked on referral partnerships and programming such as memory cafes or plant pals, an intergenerational art therapy program. Age Guide, who we're going to hear from, is a partner this round, and they worked on expanding digital literacy and data explorations with their health department. East Central Illinois Area Agency on Aging, ECIAAA. So they worked, and they're going to be speaking later, worked on social isolation programming, working with the health department. We'll hear more from Susan Riel, the executive officer, later in our webinar. And then the Egyptian Area Agency on Aging, southern part of our state, did IT training classes and referral partnerships with a number of local health and social service agencies. Next slide, please. So our recommendations report, Elise is going to chat the link, but we developed that as an outcome of that first round of funding. And there were 5 key areas for the recommendations related to capacity, planning, data and infrastructure, and funding to better support these aging and public health partnerships. Next slide. There are a number of recommendations in this report, but I'm going to focus on the ones most pertinent to today. So you see them bolded, but providing funding directly to local health departments to strengthen capacity to address these issues in partnership with the aging sector. Create a collaborative data collection and sharing approach. Measuring social connection, isolation, and loneliness in communities. One on public health and aging, opportunities and ability to engage those hard-to-reach populations together in planning efforts to maximize reach, and then ensuring public health is at the table with the AAA regional planning processes. Next slide. So we now have a new round of funding. It's from spring of this year to spring of 2026, and our goals are to implement these recommendations we've identified through that partner engagement process in year 1. Goals. So we want to help support implementing collaborative planning efforts, such as shared metrics and data gathering opportunities related to social connectedness in community needs assessment efforts. 2, building the capacity of local public health to understand their role in advancing social connection, building partnerships with the aging sector in their regions, and continuing to offer networking and sharing opportunities such as this one across the state. And next slide. So a little bit more on the specific work. So you're going to hear from Age Guide and their work with local health departments to develop a coordinated community health needs assessment, data collection processes, and developing indicators to measure social connectedness, advancing collaboration around social connectedness and programming in the region. We are having 2 webinars. We're having this one where we're introducing the topic and partners and hearing about opportunities for collaboration and planning. And then a later webinar in 26, where we're going to hear out from our communities on their work, on the chosen indicators they've selected, on their data collection collaborations, on the partnerships and programs they've built over the course of the year. And we'll be selecting 3 health departments and giving them mini grants to provide to build partnerships with aging to advance social connectedness. More on that later. Now I'm going to turn it back over to Elise to do an activity.
All right, everyone. So we are going to do a chat fall, and that is basically just where I'm going to give a prompt, and then on the count of 3, everyone is going to start putting their answers in the chat. And our question is going to be, what is one thing you are excited about in promoting social connectedness? So let's start seeing those drop into the chat in 3, 2, 1. It's great for brain health. Yes. Partnership, Jenna. Yes. Partnership, Suzanne. That's what we're all about. Oh, these are coming in fast now. Dramatic community health improvement. I like the word dramatic. Oh, these are coming in too fast. Collaboration, Leslie. Grassroots conversations. Community connectedness, collaboration, intergenerational connection. So definitely seeing a lot of different connections between sectors, between generations, between organizations, communities. This is looking great. Thank you everyone for sharing. Partnerships across orgs focusing on cross-cultural and ethnic adaptations. Achieve more with various groups, Becky. All right. Thank you all. These are all really good. And keep them coming. Getting non-traditional partners excited. Older adults connecting for friendship and peer support. So another way connection is important. All right. Thank you all for that fun activity. Feel free to keep dropping them in the chat and making more connections. And right now, I'm going to pass it along to Leah.
Thanks, everyone. Again, my name's Leah Barth, and I'm a Senior Program Manager for the Alliance for Health Equity at the Illinois Public Health Institute. The Alliance for Health Equity is one of the oldest and largest collaborative hospital health department collaborative planning processes in the US. So I'm going to give you a bit of a background on why we were formed, how we were formed, the model that we use for our collaborative process, and give you some examples of the great work that we've been able to achieve over the years as a collective group. Although the Alliance for Health Equity focuses on community well-being across the lifespan, older adults are one of our priority populations. And again, we always like to encourage folks to consider collaboration and collective impact projects to really move the needle on some of the bigger health issues facing the communities we serve. Right, next slide, please. Okay, so the Alliance for Health Equity was formed in 2015 by multiple health systems within Chicago and suburban Cook County. Previous to this, the hospitals had been developing individual community health needs assessments. They had also been relying heavily on our health departments, in particular the Chicago Department of Public Health and Cook County Department of Public Health for their data needs to complete those community health needs assessments, which was overwhelming the epidemiology staff in our capacity locally to get this information out to hospitals. Also, many of the health systems and health departments here were worried about the fact that they were potentially duplicating efforts and that there was a lot of opportunity for us to come together and pool resources so that we're spending less time and resources altogether on assessment and focusing a lot of our efforts on collective impact. As I mentioned, we partner closely with the two major health departments here in Cook County, along with other local health departments. And we have community partners from diverse sectors. I'll show you some examples of that a little bit later, but we have representation from CBOs, FQHCs, government agencies, city departments, academic institutions, folks who are on the front lines on the ground providing services, policy groups, and many more. Illinois Public Health Institute, our organization, serves as the backbone organization for the collaborative. And I'll show you the collective impact. model in just a second for those who may be unfamiliar with it. And the backbone organization sort of serves as the communicator and the glue that helps all of these different partners work together effectively and efficiently. So the structure again is that we have we have over 20 hospitals, somewhere in the neighborhood of 5 to 6 local health departments, about 100 community-based organizations, and again, IPHI serves as the backbone. We work together on both a local and regional initiatives. So we'll have, for example, hospitals that work on the west side of the city and the west suburbs will work together on a food initiative to improve community health within food deserts, for example. We also do a number of larger collaborative-wide initiatives, and these tend to also be policy-based as well, because one hospital signing support for a policy may seem insubstantial, but a majority of the nonprofit hospitals in one of the largest counties in the U.S. has a bit more impact. So we've had some success in those areas as well, and our ultimate goal, of course, is collective impact. Next slide, please. So as promised, here's the collective impact model that we use in 2015 to form our collaborative, and also it is what we use as the model for how we operate. There are 5 pillars to this model: a common agenda, shared measurement, mutually reinforcing activities, continuous communication, and a strong backbone organization. And essentially, collective impact is that network of different stakeholders who advanced equity by learning together, aligning and integrating their actions to achieve population and systems level change. So you can see the overlap with what we're trying to achieve through the work we're doing right now with aging sector partners, is that we're trying to see where we have alignment and common agendas so that we can work together to achieve greater impact overall. Alignment is central to this model. And again, as I mentioned earlier, part of the impetus for our collaborative and part of the reason we encourage use of this model for collaborative efforts is to reduce duplication and promote coordinated cross-sector efforts to address those shared problems more effectively. Next slide, please. So we use this collective impact model to achieve 2 overarching goals. In addition to what I discussed about those regional initiatives as well as those collaborative-wide initiatives, we conduct a shared assessment for our hospital partners within Cook County. So since 2015, we have completed 4 collaborative CHNAs for the county that our hospital partners use and that our health department partners draw from to complete their regulatory requirements related to community health assessment. And these CHNAs, because they're coordinated and collaborative, also allow us to implement shared strategies to improve community health, because we, as a collaborative, hospitals will often choose like 1 to 2 priorities that are specific to their hospital, and they work together with other hospitals that have those same 1 to 2 priorities, and they also tend to choose 1 to 2 additional priorities that are shared with the collaborative. For example, with our first assessment, our 4 shared priorities were the social determinants of health, improving access to care and community resources, reducing chronic disease, and improving mental health and reducing substance use disorders. Next slide, please. So here's an example. We just actually wrapped up our last CHNA in 2024. As I mentioned, it's posted on our website, allhealthequity.org, and you can access it's also on the previous slide, but you can access our full reports and our focus group reports that show the community input we garnered from the 49 focus groups we conducted across Cook County in partnership with Rush University Medical Center. And here's an example of the different priorities. And you can see there's a lot. So it takes a lot of coordination to make sure that we're tying back the different strategies that we are collaborating on to our overarching goals of improving health equity, improved quality of life, and increased life expectancy. And how we divide up this work is essentially that we have work groups formed around specific topical areas that address the health conditions or the health priorities identified in the assessment. So we have a housing and health group. We have a food work group, or food access and food security work group. We have a mental health and substance use disorders work group, and we have a social determinants of health work group that is focused on capacity building to address additional social determinants of health, as well as guiding a lot of our policy work around the social and structural determinants. Next slide, please. So these are just a few examples of what we've been able to achieve over the last 10 years in collaboration with the Alliance for Health Equity Partners. Like I mentioned, we've convened specialized work groups around things such as food access, housing stability, mental health, substance use, and the social determinants of health. We've also had specialized work groups around things such as opioid use disorder, the Trauma-Informed Hospital Collaborative. We've also worked on transportation partnerships with Lyft and Uber to provide transportation to medical appointments. So just a few examples here, like the Chicago Homeless and Health Equity Response Group, I mentioned the opioid overdose and the opioid overdose and treatment response collaborative. Sorry, pulling out all the acronyms for y'all today. We did a CEU program for mental health providers. When doing our assessment work, we discovered that people with lived experience identified providers themselves as one of the largest sources of stigma when it comes to mental health and substance use disorder treatment. So we developed an anti-stigma training program for mental health providers so that they can address internal biases and improve health outcomes for their clients. We have done policy work around Tobacco 21, medical respite capacity building in Illinois, also a number of projects related to the 1115 waiver, including the health-related social needs. Specifically, we've helped expand the Food as Medicine Veggie RX program. So again, this is just a small slice of sort of the work we've been able to achieve over the years collaboratively within the Alliance for Health Equity, showing that this can work, that it can be tricky to pull together a lot of stakeholders and partners to do collective impact, but it is certainly possible. We are one of many groups in the US doing this right now. So we are excited to see in ways you all can leverage collective impact and similar models to do your work to improve health within the aging sector. All right, I don't think I have another slide. Oh, sorry, I forgot. Here's the examples I had mentioned earlier of the AHE partners. And again, we have in the neighborhood of 100, I think it's slightly over 100 at this point, community-based partners that actively work with us. And they go from the range from the Illinois Coalition for Immigrant and Refugee Rights, so like legal policy advocacy and organizing organizations to the Transforming Communities Initiative, that Trinity Health, which is the health system that Loyola and Gottlieb and McNeil hospitals work under here in the county, to local faith-based organizations and larger food procurement groups, health department, food security, safety net agencies, hospitals. So you can see that we have so much diversity in the groups that we're engaging in this work. And just to focus on how community engagement, again, is so critical to this because it provides us with the information to understand what programs and projects are most relevant, impactful, and sustainable for the communities that we are working in. So some considerations that we always keep in our work at the top of mind is who's most impacted by the health issues, how can you amplify the voices of those most affected, who is already doing this work in communities, because remember the goal is a reduction of replication and to boost the work that's already going on and is effective. And then how can you structure decision-making processes to break down systems of oppression? Okay. And here are a few best practices that I pulled from FSG, which has some good resources around implementing collective impact. Again, you'll see that like involving community members, having that equity focus, and making sure that you have diverse, broad, cross-sector partners are important, critically important to this work. All right.
Thank you so much, Leah.
Yeah.
And now we will hear from Leslie Edstrom from HGuide.
Thank you. Good afternoon, everyone. And I am pleased to be with you today to talk about our work with our local health departments to increase social connections in our community. Next slide. In this presentation, I will briefly discuss the social connection work completed in our first grant round, and then provide an update on the work around social connectedness that is currently being done with our local health departments. Next, I will invite Tina Coral from the Kane County Health Department to share her perspective on the HGuide and Health Department collaboration and discuss how our efforts align with the Health Department goals. Finally, I will share the value of these collaborations for public health and aging services. Next slide. For our first Illinois Public Health Institute grant supported the expansion of a direct service initiative led by HGuide to strengthen social connections across the region. Through this grant, HGuide partnered with the Illinois Public Health Institute to broaden our efforts in providing low-income minority older adults with Chromebooks and iPads, along with technology training to ensure participants could confidently use these devices to stay connected. For the duration of this grant, HGuide focused on promoting digital connection, specifically in Lake County, while also strengthening our collaboration with the Kankakee County Health Department. Next slide. HGuide partnered with the Patricia A. Jones Center, Connect Lake County, and the North Chicago High School IT Club to improve digital access for older adults. Participants received tech training from both peers and teen mentors, building skills and fostering intergenerational connections. The program successfully connected 58 older adults to technology, enhancing their social connections and access to community resources. Next slide. The key takeaways during this grant period were expanded digital access for older adults through partnerships that provided technology training and fostered intergenerational connections, and our ongoing participation in the Kankakee County Health Department MAP group and other health department committees to help strengthen our connection with public health and raise awareness of the needs of older adults in our communities. Next slide. The second Illinois Public Health Institute grant expanded our health department partnerships, specifically to strengthen social connectedness across a lifespan. We are working with our region's health departments to cross-promote services like transportation, meals, and caregiver support, collect and share data collectively, and establish common survey questions to better understand and address social isolation together. The emphasis here is on shared data and mutual learning, enabling all partners to align efforts and outcomes. Next slide. HGuide and the health departments identified a key area of alignment in strengthening social connectedness by creating programs, opportunities, and spaces that foster connection across all ages. This collaboration has led to mutual invitations. Health departments have welcomed AgeGuide to present services and to join their committees, while we've invited them to participate on our councils and to bring a public health perspective to aging initiatives. Next slide. In our early meetings, I'm sorry, you went ahead one. In our early meetings, we focused on data sharing, specifically around our shared responsibility to conduct community needs assessments. We all agreed it would be valuable to include a common set of questions in our surveys and focus groups to tackle social connection over time and measure the impact of our collective work. We also recognize the importance of understanding each other's data collection and analysis methods, and committed to sharing our assessment results, strengthening our collective impact. Next slide. It wasn't long before we determined that we needed to have 2 work groups that met regularly between our quarterly meetings. These groups would be provided tasks by the larger group, also known as the Healthy Aging Roundtable, and we would come together quarterly and report back on the efforts of the work groups and get consensus from the larger group. One of these work groups was charged with creating a social connectedness awareness campaign. Next slide. This work group was formed with 2 main purposes: to strengthen opportunities for connection and engagement, and to align our efforts around raising awareness of services and reducing social isolation. To achieve these goals, the group is focused on 3 key actions. First, developing a co-branded social connectedness campaign that can be adopted by all partners. Second, cross-promoting existing programs and services to extend their reach. And third, encouraging collaboration by sharing information and resources across organizations. Next slide. The work group collectively or collaboratively selected a campaign tagline and design, which includes customizable flyers and a social media toolkit. Health departments and community-based organizations can choose from a set of themes that best align with their programs. All materials, including images, logos, colors, and text, can be modified to reflect each organization's branding. Flyers feature editable backsides for program details, contact information, or translations. The social media toolkit includes templates that can be adapted for posts that share organizations' messages and services. Next slide. The Social Connectedness Awareness Campaign launched on June 16th and will run through December 16th. Participants include our region's health departments, AgeGuide, and its funded direct service providers. To help measure the success of the Social Connectedness campaign, participating organizations are submitting monthly reports from July through December. These reports track key metrics like target audiences reached, ad and social media performance, flyers distributed, and community events. The process is simple, just a quick online form with monthly reminders sent through an Outlook calendar invite. This data not only helps us improve our outreach efforts in real time, but also provides valuable insights to share with the work group and the Healthy Aging discussion group as we work together to increase social connections across the lifespan. Next slide. There is also a Community Health Needs Assessment survey work group that meets monthly. Next slide. The purpose of this work group is to create a more coordinated, efficient efforts across sectors, especially around community needs assessments. By collaborating and sharing data between the health departments and AgeGuide, we can reduce duplication, avoid survey fatigue, and gain a clearer picture of community needs. We are also aligning strategies and sharing resources to strengthen our collective impact in addressing social isolation. To help measure our efforts consistently, we're developing standardized questions on social connectedness that can be used across assessments. For example, we want to know, are people becoming more connected as a result of our interventions? Finally, we're exploring data analysis tools to evaluate and compare findings across organizations and over time. Next slide. The Illinois Department of Public Health is sponsoring the Healthy Illinois Survey, which is a statewide survey focused on adult health experiences and behaviors. Its results will inform efforts to improve the health of Illinois residents now and in the future. Our work group has selected 3 questions from the survey to help evaluate social connectedness in each county. Questions 2 and 5 highlighted on the slide were chosen by the Community Health Needs Assessment Work Group as key indicators that we will measure. So they are: how often do you get social and emotional support that you need? And to what extent do you feel like you and your neighbors have the ability to impact the community? Next slide. The work group is also interested in question number 103.4, which asks whether you feel a sense of belonging in your neighborhood. The selection of the Healthy Illinois survey questions made by the Community Health Needs Assessment Work Group will be reviewed for approval at the upcoming Healthy Aging Roundtable discussion meeting on July 24th. Next slide. Several of our region's health departments will still be conducting their own custom needs assessment surveys, in addition to those surveys being disseminated by the Illinois Department of Public Health. The larger group of health departments have already agreed to use the social connection questions on this slide for the custom community health needs assessment surveys. AgeGuide will also be conducting our own community needs assessment survey and focus group activities, and will be incorporating these questions into our assessment surveys. Next slide, please. As you know, community needs assessments also include focus group activities. The work group reviewed a series of social connection questions which were provided by the Illinois Public Health Institute. The group has selected the questions on this slide for focus group discussions. They felt the responses to these questions would help us better understand social connections in our community. So number 1, who do people in your community turn to when they need help or support? And number 2, what changes do you think could help people feel more connected or included in your community? These questions will also be presented for approval at the upcoming Healthy Aging Roundtable. Next, I would like to turn this presentation over to Tina Coral, Health Department's Promotions Manager at the Kane County Health Department, to share her insights regarding our collaboration. Tina?
Thanks so much, Leslie. I'm Tina Coral, Health Promotions Manager for the Kane County Health Department, and I manage the communications for the Health Department, including the website, social media, printed educational materials. So when AgeGuide reached out to the local health departments about this project, we immediately saw those synergies and wanted to team up. I was part of the social connectedness work group that Leslie talked about earlier, and part of the team that developed the Community Starts with Connection logo and social media and print assets. Next slide, please. So the collaboration with AgeGuide in this campaign was very important to the Kane County Health Department because we currently don't have staff or programs that are specifically addressing the needs of older adults, but we do have that shared goal of reducing social isolation and supporting community connection. So this collaboration made it possible to reach that population with messaging and that is meaningful and informative, and with the resources that promote health connection and well-being. Kane County is fortunate to have a comprehensive set of organizations serving older adults, many who are AgeGuide funded partners, and this campaign allowed our health department to connect with those organizations and deepen our collaborations with them, and then to combine our public health outreach efforts with AgeGuide's expertise in aging services. We also appreciated the opportunity to jointly create the messaging and the look and feel of the campaign so that it would resonate with our target audience. Next slide, please. The Social Connectedness Initiative supports the health department's core goals of health equity, community engagement, and addressing the social determinants of health. Behavioral health was identified by our community as a priority issue in our 2024 Community Health Assessment. And this campaign allows us to expand our reach and prevention efforts to improve health outcomes across the lifespan. So thanks so much for the opportunity to share Kane County's role in this important initiative.
Thank you, Tina. Through these collaborations, we're putting into practice the Illinois Public Health Institute recommendations for aging, public health, and social connectedness. We're using a uniform set of needs assessment survey questions, increasing social connectedness awareness by running a joint awareness campaign, and sharing data and insights to better serve our communities. This collective effort ensures that aging is a priority within public health and that solutions are cross-sector and community-driven. Thank you, everyone.
All right, everyone. So we are now excited to tell you about this mini grant opportunity we're able to open. And by the way, thank you, Leslie and Tina. Excellent presentation. So the mini grant opportunity, IPHI is pleased to be offering local health departments support to 3 of them in 3 regions. So it'll be $5,000 per region to collaborate with aging partners to advance social connectedness. Regions with populations at greater risk of social isolation and loneliness will be prioritized. So that includes older adults with higher rates of social isolation and loneliness, such as people of color, LGBTQIA populations, caregivers, immigrants, and those with limited access to technology. Those are populations especially vulnerable to social isolation. So the application will be due Tuesday, August 12th at 5 p.m. And some examples of eligible projects to get your minds going. So engaging the regional AAA in relationship building meetings to build awareness of each other's programs and services. Utilizing the AAA to strengthen caregiver supports and referral systems through partnerships with hospitals, faith-based groups, service providers. Partnering to support cross-training and cross-advisory group participation to build that staff capacity to address social connectivity in programming planning efforts. Partnering to identify a collaborative data collection and sharing approach to measure social connection, isolation in communities, such as using common measures and community health needs assessments, and building capacity to address policies and system change concerns that might be of mutual interest and impact social isolation and loneliness. So like promoting multimodal transportation options, ensuring access to housing, or emergency preparedness or response plans. So as we mentioned, those will be due August 12th. The timeline of the project, this is September 2025 to March 2026. We're going to chat the link to the request for applications. It's already been done. Elise just put it in, and it has a lot more detail. Next slide, please. I wanted to open the floor briefly to Susan Reel, the Chief Executive Officer of the East Central Illinois Area Agency on Aging, who was one of our RRF grantees from the last round, to talk about more about that work, especially with the local health department. Susan, are you able to unmute?
I am. Thank you so much. I was just very honored to be asked to share the successes that East Central Illinois Area Agency on Aging had in Vermilion County. It was we were lucky enough to receive the special grant, and we were able to focus on a public county health department that had not really been engaged at all in collaborating with the Coordinated Point of Entry Senior Information Services Agency focal point in Danville. And so this was an opportunity to bring the 2 entities together, and it worked out beautifully because the Vermilion County Health Department had just placed a brand new administrator, Dr. O'Day. So that the focus was collaborating on social connections, utilizing the pilot project that we already had established, a reducing social isolation pilot project, utilizing Echo Show devices, Alexa devices that really help with a more of a technology-based communication level. The program had been going on for several years in Champaign and Vermilion County. So they were able to connect 15 public health clients to the CHRIS's Echo Show Reducing Social Isolation pilot project. And that the UCLA loneliness scale is the actual measurement that we utilize as a way to measure outcomes and performance impact and for all of our pilot projects throughout our 16-county area. And those scores increased improvement in reducing loneliness by about 27% when you review the pre-test to the 6-month test. Our fiscal year was 2024. So all of this work was done about a year ago. So knowing that we were very happy to be able to see the beginning of the collaboration. And then the other area that we were able to expand upon was focusing on outreach to the Hispanic population in Vermilion County. About 7% of the population is Hispanic. So that too was another offshoot in terms of Chris collaborating with the health department and with a new staff member that was able to focus in on serving the Hispanic population in Vermilion County. So that too, reducing social isolation, improving social connections, and also connecting those individuals with needed benefits and services. And then long range impact, because our grant's over with, but we're wanting to see that collaboration continue. The CEO of Chris Healthy Aging now is very active in the I-Plan process, the county health department's planning process to plan for the health needs of older residents or all residents in Vermilion County, but with the CEO being actively involved, and we are as well. We are making sure that health needs of older adults are being recognized. So that work continues. And other types of things like hosting a memory support group that's facilitated by Chris Healthy Aging that now is working with the Vermilion County Health Department to serve as a site. Also another caregiver kind of support group has also been a new connection. So where health departments, we always see them as a collaborative partner across our entire network. It really had fallen short in Vermilion County, after COVID, lots of things fell apart. But this grant allowed us to be able to build back those connections, and those connections continue. So thank you, Sarah. I think that was all I really wanted to cover.
Thank you so much, Susan. All right, I'll turn it back over to Elise to close us out.
All right, thanks, Sarah. Thanks, Susan. So I'll just go over some next steps now and what happens after this webinar. So like Sarah said, today we are releasing the RFA. I've dropped the links in the chat. They will be due Tuesday, August 12th. And following that, the 3 local health departments will implement their work over the course of 6 months. That's the project period. And then we'll host a final statewide webinar toward the end of that grant year. And we'll share the progress in both the Age Guide region and the 3 other selected regions and local health departments. We'll talk about successes and challenges in collaborative planning, potential shared metrics for community needs assessments, and highlight some actions and strategies that can hopefully be useful for groups to have a better collective understanding of the data related to social connectedness. While we know a lot is shifting in the landscape, we hope the mini grants can be useful for partnership. And with that, since we do have a few more minutes, if there's any questions about the RFA, please feel free. Otherwise, thank you all for being here.
Seeing no immediate questions in the chat, I think we can close that and we'll send all the materials to you all, and you can always reach out if you have questions. Thank you all, and thanks to our speakers.
Cool.
Thank you. Have a good evening.
Thank you.